Question 1. The nurse is monitoring a child with burns during treatment. Which assessment provides the most accurate guide to determine the adequacy of fluid resuscitation? 1. Skin turgo. 2. Level of edema at burn site. 3. Adequacy of capillary filling. 4. Amount of fluid tolerated in 24 hours. Explanation. Question 1. Rationale. Parameters such as vital signs, especially heart rate, urinary output volume, adequacy of capillary filling, and state of sensorium determine adequacy of fluid resuscitation. Although options 1, 2, and May 4th provide some information related to fluid volume in a burn injury, and from the options provided, adequacy of capillary filling is most accurate. Test-taking strategy. Note the strategic word, most. Use the ABCs, airway, breathing, and circulation, to assist in directing you to the correct option. Question 2. The parent of a 3-year-old child arrives at a clinic and tells the nurse that the child has been scratching the skin continuously and has developed a rash. The nurse assesses the child and suspects the presence of scabies. The nurse bases this suspicion on which finding noted on assessment of the child's skin? 1. Fine grayish-red lines. 2. Purple-colored lesions. 3. Thick, honey-colored crusts. 4. Clusters of fluid-filled vesicles. Explanation. Question 2. Rationale. Scabies is a parasitic skin disorder caused by an infestation of Sarcoptes scabiei, itch mite. Scabies appears as burrows or fine, grayish-red, thread-like lines. They may be difficult to see if they are obscured by excoriation and inflammation. Purple-colored lesions may indicate various disorders, including systemic conditions. Thick, honey-colored crusts are characteristic of impetigo or secondary infection in eczema. Clusters of fluid-filled vesicles are seen in herpes virus infection. Test-taking strategy. Focus on the subject, clinical manifestations of scabies. Think about the characteristic of this parasitic skin disorder. Recalling that scabies infestation produces burrows will assist in directing you to the correct option. Question 3. Permethrin is prescribed for a child with a diagnosis of scabies. The nurse would give which instruction to the parents regarding the use of this treatment? 1. Apply the lotion to areas of the rash only. 2. Apply the lotion and leave it on for 6 hours. 3. Avoid putting clothes on the child over the lotion. 4. Apply the lotion to cool, dry skin at least 30 minutes after bathing. Explanation. Question 3. Rationale. Permethrin is massaged thoroughly and gently into all skin surfaces, not just the areas that have the rash, from the head to the soles of the feet. Care needs to be taken to avoid contact with the eyes. The lotion would not be applied until at least 30 minutes after bathing and would be applied only to cool, dry skin. The lotion would be kept on for 8 to 14 hours, and then the child would be given a bath. The child would be clothed during the 8 to 14 hours of treatment contact time. Test-taking strategy. Option 3 can be eliminated because the child would be clothed. Eliminate option 1 next because of the closed-ended word only in this option. From the remaining options, Recalling the procedure for the application of this lotion will direct you to the correct option. Question 4. The school nurse has provided an instructional session about Impetigo to parents of the children attending the school. Which statement, if made by a parent, indicates a need for further instruction? 1. It is extremely contagious. 2. It is most common in humid weather. 3. Lesions most often are located on the arms and chest. 4. It might show up in an area of broken skin, such as an insect bite. Explanation. Question 4. Rationale. Impetigo is a contagious bacterial infection of the skin caused by Group A Streptococcus, gas, Streptococcus pyogenes, and Staphylococcus aureus. Impetigo is most common during hot, humid summer months. Impetigo may begin in an area of broken skin, such as an insect bite or atopic dermatitis. Impetigo is extremely contagious. Lesions usually are located around the mouth and nose, but may be present on the hands and extremities. Test-taking strategy. Note the strategic words, need for further instruction. These words indicate a negative event query and ask you to select an option that is an incorrect statement. Think about the pathophysiology associated with Impetigo. Knowledge regarding the cause and manifestations of Impetigo will direct you to the correct option. Question 5. The clinic nurse is reviewing the pediatrician's prescription for a child who has been diagnosed with lice. Lindane shampoo has been prescribed for the child. The nurse questions the prescription if which is noted in the child's record. 1. The child is 18 months old. 2. The child is being bottle-fed. 3. A sibling is using Lindane for the treatment of lice. 4. The child has a history of frequent respiratory infections. Explanation. Question 5. Rationale. Lindane shampoo is a pediculicide product that may be prescribed to treat lice. It is contraindicated for children younger than 2 years because they have more permeable skin, and high systemic absorption may occur, placing the children at risk for central nervous system toxicity and seizures. Lindane shampoo also is used with caution in children between the ages of 2 and 10 years. Siblings and other household members can be treated simultaneously. Options 2 and 4 are unrelated to the use of Lindane. Lindane is not recommended for use by a breastfeeding/chest feeding parent because the medication is secreted into human milk. Test-taking strategy. Focus on the subject, contraindications of Lindane. Recall the concepts related to the treatment of an 18-month-old child, the body surface area of children, and medication administration. These concepts will direct you to the correct option. Question 6. A topical corticosteroid is prescribed by the pediatrician for a child with contact dermatitis, eczema. Which instruction would the nurse give the parent about applying the cream? 1. Apply the cream over the entire body. 2. Apply a thick layer of cream to affected areas only. 3. Avoid cleansing the area before application of the cream. 4. Apply a thin layer of cream and rub it into the area thoroughly. Explanation. Question 6. Rationale: contact dermatitis is a superficial inflammatory process involving primarily the epidermis. A topical corticosteroid may be prescribed and would be applied sparingly, thin layer, and rubbed into the area thoroughly. The affected area would be cleaned gently before application. A topical corticosteroid would not be applied over extensive areas. Systemic absorption is more likely to occur with extensive application. Test-taking strategy: focus on the subject, application of a topical corticosteroid. Eliminate option 3 first because it does not make sense not to clean an affected area. Eliminate option 1 because medicated cream would be applied only to areas that are affected. Eliminate option 2 because of the word thick. Question 7. The school nurse is performing pediculosis capitis, head lice, assessments. Which assessment finding indicates that a child has a positive head check for lice? 1. Maculopapular lesions behind the ears. 2. Lesions in the scalp that extend to the hairline or neck. 3. White raky particles throughout the entire scalp region. 4. White sacs attached to the hair shafts in the occipital area. Explanation. Question 7. Rationale: pediculosis capitis is an infestation of the hair and scalp with lice. The nits are visible and attached firmly to the hair shaft near the scalp. The occiput is an area in which nits can be seen. Maculopapular lesions behind the ears or lesions that extend to the hairline or neck are indicative of an infectious process, not pediculosis. White flaky particles are indicative of dandruff. Test-taking strategy: focus on the subject, the characteristics of pediculosis capitis. Option 3 can be eliminated first, because white flaky particles are indicative of dandruff. Recalling that in this infestation nit sacs attached to the hair shaft will direct you to the correct option. Question 8. The nurse caring for a child who sustained a burn injury plans care based on which pediatric considerations associated with this injury? Select all that apply. 1. Scarring is less severe in a child than in an adult. 2. A delay in growth may occur after a burn injury. 3. An immature immune system presents an increased risk of infection for infants and young children. 4. Fluid resuscitation is unnecessary unless the burned area is more than 25% of the total body surface area. 5. The lower proportion of body fluid to body mass in a child increases the risk of cardiovascular problems. 6. Infants and young children are at increased risk for protein and calorie deficiency because they have smaller muscle mass and less body fat than adults. Explanation. Question 8. Rationale: pediatric considerations in the care of a burn victim include the following. Scarring is more severe in a child than in an adult. A delay in growth may occur after a burn injury. An immature immune system presents an increased risk of infection for infants and young children. The higher proportion of body fluid to body mass in a child increases the risk of cardiovascular problems. Burns involving more than 10% of total body surface area require some form of fluid resuscitation. Infants and young children are at increased risk for protein and calorie deficiencies because they have smaller muscle mass and less body fat than adults. Test-taking strategy. Focus on the subject. Pediatric considerations in the care of a child who has sustained a burn injury. To answer correctly, read each option carefully and think about the physiology of a child related to body size.